Okay, hi YouTube. It has been about 2 weeks since my last video, but that's okay because now I have more updates to share with you. So I think first is that as of last week, I am now at 2.5 years of hormone replacement therapy. So I guess it's a mile marker or whatever. I'm sure there are probably couples out there that celebrate their 2.5 year anniversary or whatever. So it's out there. I've been on kind of my full maximum dose of HRT now for about a year and a half. Wish I got a little bit more results up here, but so be it. Can always get a breast augmentation later. And so speaking of surgery, that is kind of the big update that, as you're aware of, I went to see Dr. McGinn in July, had my consultation, and now I've, as of 2 weeks ago really, put down my deposit for a surgery date at the end of this year, which means that by my 30th birthday, by the time I've been on 3 years of HRT, I will have had sexual reassignment surgery, SRS, and I will have a vagina and be moving on with my life. And that's not to say that I will be done with transition or done being trans, just that I will have that out of the way. But before I can get that done, there's still a lot left for me to do, both in terms of just preparing for the surgery, so getting those 2 letters of recommendation from therapists and mental health professionals, getting my blood work done, my physical, EKGs, things like that you actually need to have the surgery completed, going through those insurance steps to make sure that they pay for everything that they're supposed to pay for, and then also making sure that I go through those same kind of logistical hoops or whatever with my employer, my HR, my manager, so that I'm taking leave off, that everybody's aware, cross my T's, dot my I's, somebody can take over my project work for the 4-6 weeks I'm out, everything like that, so I don't have to worry about anything but recovering. And so I will hopefully have a lot more content for you over the next couple of months as a result of basically going through all this prep work for surgery. And then I think at some point I still want to have a breast augmentation done. I don't know if I'll do that this year or next year. And I think now I'm pretty well settled on the fact that I do want some facial feminization surgery. That will not happen this year. That will have to be next year. And that unfortunately won't be covered by insurance. So that might be something that I really just have to save up for. But I'm also, I guess, a third milestone, now that I've waited this long to make this video, is that I'm roughly at the time now where I've been making these YouTube videos for a year. So first, thank you all for watching. Thank you for your support. Thank you for your comments. Not necessarily negative ones, but I read every single one, and I often collect ideas from people to make videos, and so this one actually came from a fan of mine Facebook page, so facebook.com/loosebricks. You can also get there directly from loosebricks.com. And this comes from Justin, who asked me, what would you do differently if you were doing transition all over again? And so I will constrain myself to answering that question from kind of around the time I started hormones, rather than at any point before that, because I think the first answer would be transition earlier in my life. And I think that hindsight is 20/20 and makes that a lot easier to say, but the things that I actually would do differently, I think, are echoed by most trans women at least, is that starting hair removal sooner. HRT turned my facial hair basically blonde immediately, which meant that laser was no longer a kind of viable solution. So I had to use electrolysis, which is pretty painful, pretty time consuming, and had to do that as a result. So I probably would have started that maybe before transition, or kind of as soon as I started hormones. And then along with that, the other thing I would have started doing right off the bat is working on my voice maybe a little bit more. Or not necessarily right off the bat, but I didn't honestly start working on my voice until I was presenting as female. And that obviously creates kind of a disjointed experience when I sounded way more masculine than I do now, and I sounded even way more masculine than I did when I first started making my YouTube videos last August. And so if you go back and you watch some of those, you can see that I beat myself up over my voice. I think that's well deserved because I don't think my voice was anywhere near as good back then as it is now. And I still don't think my voice now is as good as it could be. And I continue to practice. I continue to work on refining it. You know, I still do several takes of a video before I actually find one that I like. And if I had started making the YouTube videos or just starting doing recordings on my own, and I did a little bit of that without making them public, I think that I would have given myself a little bit more of a head start. And those are the two things that I can safely say I would have done differently. I think the third thing that I might have done differently is spend less time between part-time and kind of full-time. And so while I presented as female for the first time out in public on my birthday, February 9, 2012, after that and before I sort of really did go full-time, I would sort of jump back and forth quite a bit. And then even into, later that summer and the fall when I'm still looking for a job, because I wasn't necessarily always leaving the house every day, you don't get cleaned up, you don't necessarily talk, things like that, or at least I didn't. And so I think it sort of reinforces or makes it more obvious the fact that you are trans. And so for me, one of the big hurdles that I still kind of deal with even now is seeing myself just as a woman, not as a trans woman. And I don't think that sort of limbo time in between helped. I also don't think not having a job, that didn't help either. But, now that I've been working at this job for 6 months, presenting as female day in, day out, I don't even go to the grocery store or take out my trash, really, without kind of looking like, okay, if I were to not go back to my apartment after this, would I be okay with that? And while I think that's something for me specifically, I think that helps kind of get past that you're trans hurdle a little bit quicker. And so for me, those are the things that I would have done differently. I think maybe to help with that, I could have done things like, get rid of my boy clothes, or specific pieces of the boy clothes. I don't know. I don't know exactly how I would have done it differently, because part of it too was that I wasn't as good with makeup back then. So maybe even just things like, just practice at home and wear it around the house maybe would have been a nice compromise to where you don't have to feel like you have to go out in public, but at least you're reinforcing that image at home. And that is what I would have done differently. If other people have comments, thoughts, ideas for new videos, leave them in the YouTube, leave them on my Facebook wall, wherever. Like I've said, I read every single comment that I get, whether that is through YouTube or whether that is on my Facebook. I don't actually necessarily see everything through Twitter, but those other two channels, I do still look at them. So if you have something that you want to see me talk about, I'm more than happy to try to fit that into a video.